Hi, this is the Modern Dental Assisting book, Chapter 9, and we're going to be going over head and neck anatomy. You will have this information again in another module, but this is so that you can help understand the anatomy for dental radiography. So the head is divided up into regions, and it's divided into 11 regions, as you can see here. The frontal, parietal, occipital, temporal, orbital, nasal, infraorbital, zygomatic, buccal, oral, and mental, which we're going to go over each of these individually. The human skull has two sections. The first section is the cranium, and it's composed of 8 bones that cover and protect the brain. The face consists of 4 bones. The bones of the cranium have single and paired bones. For the single bones, we have the frontal bone, which forms the forehead, part of the floor of the cranium, and most of the roof of the orbits. The orbit is the bony cavity that protects the eye, and the frontal bone contains the 2 frontal sinuses, one located above each eye. The occipital bone forms the back and base of the cranium, and it joins with the parietal bones and the lambdoid suture. The spinal cord passes through the foramen magnum, which is the big hole or opening that's at the base of your skull that allows the spinal cord to enter and meet with the brainstem. Then we have the sphenoid bone, which is made up of a body of paired greater and lesser wings. It forms the anterior part or the front part of the base of the skull. And we have the ethmoid bone, which forms part of the floor or the base of the cranium in the orbit and the nasal cavity. This complex bone contains honeycomb spaces, and the ethmoid sinuses, the medial concha, and the superior concha are like scroll-like structures that extend from the ethmoid bone. There are 2 paired bones. The parietal bones form the most of the roof and upper sides of the cranium, and they're joined at the sagittal suture at the midline of the skull. And then we have the temporal bones. So just like you would think, they're by your temples, and they're paired bones that form the sides and the base of the cranium. Each temporal bone encloses an ear and contains the external auditory meatus, which is the bony passage of the outer ear. The auditory ossicles are the middle ear is composed of 3 tiny bones named the auditory ossicles. Each ear contains 1 malleus or hammer, incus or an anvil, and stapes or stirrup. These bones transmit vibrations caused by sound waves from the eardrum. With the bones of the face, they're visible on the anterior or the front view of the skull, and they include the lacrimal, nasal, vomer, nasal concha, zygomatic bone, maxilla, mandible, and palatine bones, which are technically not facial, but they are included. So with the zygomatic bones, they're also known as malar bones, and they form the prominence of the cheek and the lateral wall and floor of the orbit of the eyes. The zygomatic bones rest on the maxillary bones and each articulate with the left or right zygomatic process, and the temporal process of the zygomatic bone articulates with the zygomatic process and the temporal bone to form the zygomatic arch, which creates the prominence of the cheek. and they're useful in identifying maxillary radiographs. So when you're looking at your maxillary radiographs, you're going to look for that zygomatic arch to help you decide if it is a maxillary radiograph or a mandibular radiograph. The two maxillary bones, known as maxillae, singular maxilla, form the upper jaw and part of the hard palate. The maxillary bones are joined together at the midline. Remember, the midline is what divides our body into right and left equal halves. And they're joined together by the maxillary suture. The maxillary bones contain the maxillary sinuses. The alveolar process of the maxillary bone forms the support for the teeth of the maxillary arch. In this, the maxillary tuberosity is a larger rounded area on the outer surface of the maxillary bones in the area of the posterior teeth. It's also a useful landmark for mounting maxillary radiographs. The palatine bones are paired between the maxillae and the pterygoid process of the sphenoid bone. Nasal bones, there are two nasal bones that form the bridge of the nose. Superiorly, which means towards the top, they articulate with the frontal bone and make up a small portion of the nasal septum. The two lacrimal bones make up part of the orbit at the inner angle of the eye. These small thin bones lie directly behind the frontal process of the maxillary bones. They're very delicate bones and are broken very easily. The vomer is a single flat bone that forms the base of the nasal septum. And nasal concha, each lateral wall of the nasal cavity consists of three projecting structures that extend inward from the maxilla called the nasal concha. Each extends scroll-like into the nasal cavity. In the superior, middle, and inferior nasal concha are formed with the ethmoid bone. The mandible forms the lower jaw. Now, the mandible is the only movable bone of the skull, and you need to know that. So everything else is stationary except the mandible can move. It's U-shaped and is the strongest and longest bone in the face. It develops prenatally as two parts. In early childhood, however, it ossifies or hardens into one single bone. The symphysis is located in the midline and forms into the mental protuberance, commonly called the chin. So mental means chin. So if you hear mental somewhere in dentistry, they're talking about the chin. There's also something called a mental foramen, which you'll learn about later, which is an identification mark in x-rays. So that mental foramen is towards the chin. So that foramen is actually located on the facial surface of the left and right between the apices of the first and second mandibular premolars. The hyoid bone is very unique because it doesn't articulate or come together, which is what articulate means, with any other bone. It's suspended between the mandible and the larynx. It's like an inverted Y, and it just kind of hangs there. It's the primary support for the tongue and other muscles. So it has a central body and two lateral projections. It's suspended from the styloid process of the temporal bone by two stylohyoid ligaments. In postnatal development, at birth, the cranial vault is large and the cranial base and the face are small. So the face lacks vertical dimension because the teeth haven't erupted yet, which gives them, babies that little babyish face or cartoonish kind of look. But once their teeth start coming in, the dimension of their face changes and gives them a very different look to their face. Several bones of the skull don't fuse until after birth. The mandible is in two halves at birth and fuses later at that symphysis menti, like I had just talked about. With the temporomandibular joint, it's a joint that's on each side of the head that allows for movement on the mandible for speech and mastication, which mastication means chewing. So that joint, or we call it a TMJ, is what allows your jaw to open and close. So it's named for the temporal bone and the mandible, which is where it meets and those two bones articulate. It has three bony parts: the glenoid fossa, the articular eminence, and the condyloid process. So this joint allows us to chew and to speak. The glenoid fossa, which is lined with a fibrous connective tissue, is an oval depression in the temporal bone just anterior to the external auditory meatus. The articular eminence is raised portion of the temporal bone just anterior to the glenoid fossa, and the condyloid process of the mandible lies in the glenoid fossa. The capsular ligament is a fibrous joint capsule, completely encloses the TMJ, and it wraps around the margin of the temporal bone's articular eminence to an articular fossa superiorly. Inferiorly, the capsule wraps around the circumference of the mandible condyle, including the condylar neck. The articular space is the area between the capsular ligament and the surfaces of the glenoid fossa and the condyle. And the articular disc, also known as the meniscus, is the cushion of the dense, specialized connective tissue that divides the articular space into two upper and lower compartments. And they're filled with synovial fluid, which is like a lubricant for the joints and fills those cavities. For jaw movement of the TMJ, all joints move differently. So with the TMJ joint, it has two different actions. It has a hinge action, which is the first phase of opening your mouth. Only the lower compartment of the joint is used in that action. And that's when the condylar head rotates around the point on the undersurface of the articular disc, and the body of the mandible drops almost passively downward and backward. And then it has a gliding movement that allows the lower jaw to move forward or backward. It involves both the lower and upper compartments, and the condyle and articular disc glide forward and down along the articular eminence. So with temporomandibular joint, because it is a joint, it can have disorders. They are called TMD, or temporomandibular disorders. A patient can experience a disease process associated with one side of their TMJ or both. TMD is complex, and it can have factors like stress, clenching, or bruxism. So clenching, of course, is just holding your teeth together tightly, but bruxism is grinding of the teeth. TMD can also be caused by trauma to the jaw, systemic diseases such as osteoarthritis, or wear due to aging. There are different categories of TMD. There are acute masticatory muscle complaints, articular disc derangement, extrinsic trauma, joint diseases, and chronic mandibular hypermobility. So with acute masticatory muscle complaints, people will have muscle inflammation, spasms, and they can wear protective muscle splinting. With articular disc derangement, the disc, which allows smooth movement of the muscle, might be displaced or damaged. That can cause clicking sounds and limited ability to open the mouth. Extrinsic trauma are caused by external causes and involve dislocation of the joint, fracture of bones, and internal derangement of the joint. Joint diseases can be degenerative, inflammatory forms of arthritis, and may severely damage the joint. And other chronic mandibular hypermobility means a limited ability to move. Hypomobility, I'm sorry, that should say. Hypomobility is a limited ability to move, and the mandible may be influenced by damage to the joint, bony portions of the articular capsule, or shortening of the muscles of mastication or damage to the articular disc. The diagnosis and treatment of TMD can be difficult, and the patient can sometimes the treatment can last a long time. Some cases require the involvement of dentists, physicians, psychiatrists, and psychologists, neurologists, neurosurgeons, and others. So they can experience pain, joint sounds, limitations of movement. It can be a result of stress. Frequent oral habits like clenching their teeth or bruxism are important contributing factors. And other causes of TMD include accidents involving injuries to the jaw, head, or neck, diseases of the joint, like several varieties of arthritis, and malocclusion, when the teeth come together in a manner that produces abnormal strain on the joint and surrounding areas. And that concludes this session. Thank you.